My name is Dr. Labib Gulmiya. I'm a double board certified OBGYN and a maternal-fetal medicine specialist. I'm also a functional medicine certified provider. I've been in practice for almost 24 years. I take care of pregnant patients. I help women as well as couples conceiving as well as having a healthy pregnancy without any complications. In addition, I'm also passionate about the world of toxins and how we can lower our exposures. When it comes to toxins, it was actually a personal experience that made me interested in toxins. Unfortunately, in medical school, we don't learn much about toxins. However, because of my personal health, my family, my son was diagnosed with autism. I had low testosterone levels, so all this made me seek a root cause of this, and this led me to the toxin world, and that's why I decided to research toxins and help people avoid what I went through.
What do you define as a toxin?
Well, toxins, actually the scientific word for toxin is toxicants. Toxins can be found in nature. Not all of them are harmful, but there are also toxicants that us as humans created from industry, from all the advancement that we've done. We've created toxicants that could be found everywhere around us, from the food, from the water, from the air, and then there are, of course, some of them that are invisible, and these are the ones that could be also harmful. So it's very important to know that they exist and try to lower the load on our body and our cells in order to thrive and optimize our health. There are multiple toxins and multiple pathways of how toxins can affect the body. So it all depends how they enter the body. Some of them can disrupt our hormones. Some of them can disrupt even the cell membranes. If we're talking about the cell at the cellular level, they can break down the cell membranes, get into the nucleus, and cause oxidative stress and DNA damage, which can have long-term effects because these cells are replicating. So if you're replicating an already damaged cell with a damaged DNA, the progeny of these cells are going to be also damaged. So there are multiple pathways how they can affect us. Some of them can get into our gut and cause inflammation. And we know inflamed cells are weak cells. So once they're weak, maybe another toxin can come in, such as EMF, for example. And with those dependent ways, it can cause more and more damage to our cells. So it is a multiple pathway damage that toxicants can cause to our health. We're all exposed to toxins. We're all exposed to EMF or radiation. But I think in the last 20, 30 years, we've been exposed to more toxicants. And this cumulative effect of multiple toxins is what is maybe showing as chronic disease that we haven't seen higher. Now we're seeing more kids with autism. Genetics don't explain all these alone. So there is something that's causing the second hit, which can probably be our lifestyle. That includes toxins, whether they're hidden toxins or they are chemicals in our products, or today we are all exposed to cell phones. I think 90% or even more of the world population has a cell phone, for example, and we know cell phones do emit radio frequency radiation, and the way we use it, the hours we use it, all of this is adding to our exposure. The human body is actually able to adapt to certain amount of radio frequency or some radiation because it comes from Earth, from the cosmic radiation. But when we add to it this, and when our cells are already inflamed and sick, this is gonna accumulate with time and cause diseases. So I think, from my standpoint, other than the health of people in general, pregnancy, pre-pregnancy, or preparing to pregnancy, and the window of these 9 months is when a baby is getting formed, is very critical because the cells are multiplying very fast, and if we injure them in any way possible, whether something that's getting exposed externally directly to the baby, like EMF, or toxicants getting into the mom's body and then to the baby, all these can affect their health when they're born, and then this can have long-term consequences. We know babies, for example, that are born small for any reason, those people or those babies, when they grow up, we're talking about their 40s and 50s, they have chronic diseases, a higher risk of diabetes, hypertension. And this is a theory that's been proven in animal models as well as in epidemiological studies. So we know the health of the woman is super important for our next generation. So yeah, I mean, I think some of the toxins are visible, but some are not. And I always like to say, let's try to make this invisible visible. Like, in the past, we used to see infections like viruses and bacteria. We didn't know what they were. And now we know, and we have vaccines and we have treatments, antibiotics. And so we made the invisible visible today, but there's still things like EMF, for example, that's not visible. And I think it's time to make it visible and educate people about it and try to minimize our exposure. We can't be EMF or toxicant free, and we don't expect that, but at least lower it for the sake of our next generation.
So let's talk about men in particular and how your work, what you're seeing in your work, and maybe what guidance you're most commonly giving to men that are trying to conceive.
Yeah. So when we talk about EMF and fertility, whether in men or women, this is a big topic, has been controversial over the last few years. Some people are saying that it is probably safe to be exposed to EMF, and there are studies showing the opposite. Well, today we know EMF does cause changes in the cells. This is unquestionable. The question is, does it affect fertility per se? So one aspect of fertility is the man and the sperm. And yes, there are studies, there are meta-analyses that showed that exposure to EMF has effect on the sperm, which is also a type of cell that's multiplying. Every 72 hours we produce new sperm, so it's a very active sort of cell. So yes, EMF does affect their count, does affect also their motility, how they move around in order to get to the egg and to fertilize it. So there is an effect on the sperm per se, and also there's effect on the testosterone level. And this is what we see today. We're seeing younger and younger men having lower testosterone levels because of toxicants, because of pesticides, because of smoking, because of EMF exposure. So it's a combination of things. We cannot pinpoint only one cause, but definitely EMF, long hours of EMF have shown to decrease sperm counts by up to 20% sometimes in certain studies. Some of these studies were done in animals and some of them were done in humans. So when it comes to men, and as you know, testicles are outside the body, so they're more prone to this effect. Especially a lot of us are used to putting their cell phones in their pockets, laptops on our knees, and our thighs and work. So we're always bombarded by those things. So yes, there is an effect of EMF to sperm count and motility, which is going to affect fertility. That's one. When it comes to women, it's a little bit more controversial, but of course, it does affect, the hormone, and you need estrogen to produce eggs, so it can affect that aspect. The ovaries are protected inside the body, so they may be, less vulnerable than the testes, but the follicles do also produce, multiply more than sperm, so they're also prone if they are touched. So also cell phones and laptops, Wi-Fi that's continuously bombarding a woman can affect their sperm, their follicular count. So that's another, and a big thing that not many people talk about is how EMF affects our sleep and affect our melatonin production, and this is related to the fertility too. So there are multiple pathways, but definitely there's something there. Unfortunately, we don't have specific guidelines on to test for certain. I know there are ways to test for EMF and how much we're being exposed to, but from the medical standpoint, we don't have like a blood test to tell us how much EMF you're exposed to, and and we have no guidelines. Most of the consensus is screen patients for toxicants, but they don't tell us how to screen them. There's no standardized questionnaires. But it's important to do this before pregnancy, during pregnancy, continuously checking on these women during their prenatal care, make sure they're not getting exposed to those or minimizing the exposure during that process, during those 9 months, and of course, after birth and when the baby is at home. But we don't have guidelines because the data supposedly is limited. But again, I believe in limited data, but there's something there. Why do we have to wait until a lot of damage has been done, then come back and say, oh yes, we were right, we should have minimized our exposure? So the fact there is something, there is some fire somewhere, I think it means this is a red flag, and we have to work early on before it's too late. Yeah, definitely we are seeing more, cases of, infertility, male infertility and female, it's like around 40% of, having a male factor. And there's always this 10% that we can't explain. But now, if you think about it, I mean, if on the outside these people look healthy and they have no medical issues, so why is this unexplained infertility? So this is where I think the invisible infertility is coming in. And yes, we are seeing lower testosterone, lower sperm counts for sure throughout the world in the last 30 years. So if you take a 30-year-old male today, his sperm count is way lower than a male his age 30 or 40 years ago, no doubt. So yes, and this cannot be seen on the outside. You have to do the testing. The person might seem healthy, but without testing their sperm, their motility, their morphology of their sperm, you cannot know. What we're also seeing is, and then of course, this might be biased because I work with high risk patients. We're seeing maybe higher miscarriage rates, and of course the miscarriage rate goes up with age, but we know there's certain studies that looked at people that are more exposed to EMF having higher miscarriages. So yes, we are seeing more miscarriage rates. I cannot say the number because there's no certain number. It's difficult to estimate the miscarriage rate, but definitely it's going up because of those two factors. So when it comes to, in general wellness and health, I use the acronym MIND, M-I-N-D. So M is for mental health. Today mental health is huge. We have a lot of issues there. It's still a taboo in certain areas of the world, and even in developed countries, nobody wants to talk about mental health, especially in men. When you talk about mental health in men, you feel it's a vulnerable person who has mental problems. But we are having more loneliness, more depression, more anxiety. So mental health is huge, especially when it comes to fertility. If you are going through a fertility treatment or you wanna conceive and you are not feeling well, it's not gonna happen. You need positive attitude. You need to feel well when this is happening. So mental health is big. So this is the big M. I for me is intensity, and this is exercise. We're not exercising as much. We're not outdoors as much. So this is very important. A huge pillar of exercise. And then N, nutrition. Food is medicine. We know there's a lot of talk about the quality of the food that we're getting exposed to, the pesticides, all of this. So trying to concentrate on eating, whole, clean food is crucial in this world. And then D is dream, which is sleep. And I can't emphasize the importance of sleep and how people lack sleep because of not feeling well, being anxious, not sleeping well, and this becomes a vicious circle. And when you don't sleep well, you don't clean your cells well, your hormones are messed up, your ovulation is gonna get messed up, your sperm production is gonna get messed up. It becomes a chaotic thing. So you really need those mind, M-I-N-D, to have a sane mind. And whenever you have a sane mind, you have a sane body, and vice versa. So yeah, sleep is very important. Melatonin is one of the hormones that helps with sleep. But like I said, it can affect fertility. In pregnancy, we know also if your melatonin is dysfunctional, dysregulated, there are some studies that show it's associated with increased risk of preterm labor. So, and in the last 30 years, we have not been able to lower the preterm labor rate. We've done everything. There's a lot of studies, but we're still having the same preterm labor rate. Sometimes even, it's getting higher. So, and EMF, toxicants, all this can affect melatonin, and this is leading to, maybe higher risk of preterm labor. People have looked even at, EMF and toxicants affecting the growth of the babies. There are some studies on, heavy metals causing, smaller babies. EMF is still, questionable. There's not solid data about it affecting the growth of the baby. But again, we don't know. And maybe more exposure might lead to more problems. But yes, I as far as the pillars M, I, and D, and the D, even though it's at the end of the word, it's very important. So dream, sleep is extremely, and it's one of the major pillars of our health, and fertility, of course. All these can be affected by our lifestyle. And yes, toxicants, whether they are chemical toxicants, environmental toxicants, EMF, all this can affect the 4 pillars. So, being exposed to EMF for a long period of time, can affect our mental health. Being exposed to other chemicals like pesticides can mess up our gut, which can affect our nutrition. Our energy levels, if the mitochondria are affected by, all these toxicants, we won't have energy to exercise. And then sleep, if you are exposed to Wi-Fi continuously at all times, your sleep will be disrupted and you won't feel well. And I'm one of the guilty people that used to put my, the earpods and sleep, and while listening to music or other things, and I would wake up in the middle of the night, the music is still going on or a YouTube video is still going on. And I noticed those nights, even if I slept 7 or 8 hours, were not as restful as if I had those not close to me or in another room. So definitely there is something, all this, vibration and all this radiation that can affect with our electric system. Again, the heart needs electricity, the brain is all, electrical, ions going in and out of cells. So there's something from the outside messing up this current, it's gonna mess up the whole system. And this is maybe one of the ways EMF affects our cells. Plus, you talked about how it can affect the DNA, the hormones, and on every level it can affect us. Plus the heat, this is something we did not talk about, is like, our cell phones, our laptops emit heat, and this heat can really, even if you don't feel it, even if you're wearing layers or you have your phone in your purse or on your waist, it still can give up heat that can disrupt those cells. But not to scare people, I think prolonged exposure, I'm talking 4, 5, or 10 hours a day, using your phone 20 times or more per day, having it close to your body for a long period of time. If you're pregnant, having it close to your belly, all this has to be really in excess for your body to give up and cause problems. There's one thing I want to talk also about, when it comes to men and the heat, not only the EMF. Again, the testicles are outside the body for a reason, so that they won't have the temperature of the body in order to produce sperm. Anytime, people have infections and have high fever, it can affect the sperm production. So there is a reason physiologically why they're outside the body, to have a cooler temperature than the core body. So by heating them through, prolonged, hot tubs or saunas, or like something easier that's available most of the time, is cell phones or laptops or anything else, then this can affect the sperm count and the function of the testes. So this is very important to think about. When it comes to pregnancy, yes, pregnancy is a very dynamic, process. It is 9 months of, stress on the body of the woman. There's a baby forming inside. The first trimester, the first 12 to 13 weeks is when the baby is forming. All our organs form the first 12 weeks. So if you look at the baby on an ultrasound at 12, 13 weeks, the baby is fully formed. But then these are when the cells start multiplying. So if you cause an issue in the beginning of the pregnancy during this vulnerable time, it's gonna affect, it might, cause, if some of these chemicals are teratogenic, they can cause congenital malformation. If they're not, they might affect the growth of the baby, they can cause a miscarriage. So this is a very vulnerable period where we really have to instruct, women to try to minimize their exposure to everything during that time, because this is, when we need their body to be in the best shape possible. Preferably before pregnancy, this should start, but if not, during that phase. But then even after that, the baby is developing. The body of the female is also going through a lot of physiological changes. So you don't want to add more stress to that process. And imagine someone that ends up having, hypertension, preterm labor, diabetes, and you are also bombarding them with toxicants and, many other things. So, and, the pregnancy is a very, I call it the window for your future health. It's a good time and a golden time to fix your health if you can, but also you're fixing your own health, your family's health, and your baby. So it's a very vulnerable period that I think patients as well as physicians, providers should educate women about their exposure to everything without causing fear. Just few small baby steps, few tricks here and there to decrease this exposure is key. And little bit of decreasing, let's say, plastic exposure or pesticides or EMF, all this will make a difference in the long term. So I think don't get overwhelmed, just do baby steps, do one thing at a time, and treat pregnancy as if it's a golden opportunity to start fresh and start from scratch, especially for your unborn kid. I think one of the toughest things is to talk to people about all these toxicants, and as if you're talking something invisible. Most people feel that they're invincible, nothing's gonna happen to their health. I think I learned over the years that the best strategy, and this is the most important, is to be kind to these people and to align yourself with them, because not everybody understands these things at the same level. So you have to explain it. If you say EMF to somebody who has never heard of EMF, or you talk about glyphosate, which is a pesticide, they don't care about these. So you have to explain and align yourself. And this is, I think, a rule for everything. Whenever we want to give instructions, it shouldn't be like I'm the doctor, you should listen to me, these are my orders, my instructions. You have to give them those instructions that align with their life. That again, some people, for example, with diabetes, if you keep telling them, check your sugars every 2 hours, do this, sleep well, exercise. I mean, some people don't have the luxury of, exercising or going out. They don't have time. They have 5 kids. They don't have, maybe enough resources to buy a machine, to test, let's say, their toxins. So you have to really align yourself with these people and try to incorporate these instructions based on their lifestyle. I think this is the major problem that we have. Throwing out guidelines and instructions do not apply for everyone. So I think alignment and kindness is what will go a long way when it comes to everything in life, as far as counseling and giving instructions and giving advice. So when it comes to being a medical doctor, we've been trained in what we call now conventional medicine, which is extremely powerful. I mean, this is a type of medicine that treats diseases, takes care of emergencies. We cannot live without this, and it has taken us years and years of training, and a lot of advancement have happened. However, because of my own experience and because looking at certain things holistically or functionally, or getting into the root cause, I think is so important to help those diseases at the same time with the conventional. So I think separating those two is not healthy is not the correct way. I think we should combine, finding the root cause and treating the disease. Going into, prevention. Prevention is key. Yes, it's a big word, prevention. So where do we start? But yeah, I think this is the power of prevention, improving our health span, being healthy when we live, being happy. I don't want to be in bed at the age of 60 and feel miserable and have family members take care of me and ending up suffering and having pain and dying. I prefer to live, and everybody I'm sure is the same. They want to live happy, be productive throughout their years of life. So combining holistic, and I think the word holistic doesn't take its value. People feel it is voodoo science, and it's things that are not, on the contrary. Holistic doesn't have to be things that are super outside the box. There are studies, there are evidence in that too. So combining those two, picking things that will work for your patients, for your family, for yourself, and in addition to conventional medicine, I think this is where the power is. And I discovered this in the last 5-6 years that we should look at diseases from different angles, not just one thing causing one disease. That can be multiple things, and working on multiple pillars, like we discussed previously, is the key for better health span and hopefully a lifespan too. So yeah, when it comes to exposures, or what we call the exposome, like what we're exposed to on a daily basis, it becomes really overwhelming. Like, where do you start from? Should you throw the plastics? Should you purify the air? Should you change your water, test your water, your bed sheets, your clothes, your car? It becomes so overwhelming. I think the major thing to do is to think about what are the things that you're exposed to the longest possible, and which are causing you most harm. So if you start thinking about your day from the moment you wake up, if you are on your cell phone from the minute you wake up until the end of the day, and even your cell phone can tell you how long you've been on certain applications, and if you notice that the number is going up, probably this is more major than maybe, I don't know, your bed sheets being cleaned with some sort of detergent. So try to figure out where is the major source of your exposure. And I think Wi-Fi, microwaves, cell phones, computers is a major part of our life, especially working people that are in offices all the time, traveling. So I think this is a part that we need to concentrate on, and with simple, products that can, either block or harmonize, these EMFs, which will keep, the signal going on, because blockers can sometimes completely shut down the Wi-Fi, for example. But if you have devices that can harmonize your EMF, and these are used by athletes, and so there is science definitely behind it, then this might be a good solution. And then avoid having your cell phone close to you. Anytime you can, stay away from it. Try to, of course, if you use your AirPods for a short period of time, it's okay, but don't keep this the whole night like I did, or the whole day, and talking to, and anyway, it looks weird having it and talking. You feel like, the other day I passed a person, he was talking on the phone. I thought he was talking to me, and it was the earpod in his brain and his ear, and he was talking to someone else. So yeah, having this the whole day is the problem. I was connected to Aries, through the Biohacker Self movement by Lolly Brands, and I'm very excited to talk about one aspect of toxicants and toxins that we don't talk a lot about. We talk about all the rest of the toxicants, but EMF is like a field that still kind of a taboo. Not many people talk about it because it's still invisible. And one of the messages I want to spread out there is to, like we did in the past, with viruses and bacteria, made them visible today. I want to make those, toxicants in our world visible. So let's try to make the invisible visible, and let's try to reframe the way we look at health, not just, band-aid, therapies, go to the basics, go back to what our ancestors were doing, try to live healthy, happy, without overwhelming yourself, and just look at your health from a different perspective and reframe your health is my final message.